Hi everyone, we are here at the EIS Symposium and we have the pleasure of talking with Murphy Jensen and Daniela Tudor, both from WEconnect, both founders, is that right?
Yes, ma'am.
Okay, and you're the Senior Vice President and you are the CEO, is that right? Oh, points for me, I got it right.
Good work.
Thank you. So
You are Tracy.
I am Tracy with the National Alliance.
Awesome.
So tell me a little bit about WEconnect. I was enthralled listening to you guys talk about it in there, so share with our viewers just a little bit about your company.
Danielle?
Sure.
Ladies first.
Thank you so much, Murphy, and thank you for having us. So WeConnect is a relapse prevention on-the-go mobile application that also ties into a data outcomes platform. Basically, our mission is to reduce relapse for those that are in recovery from drug and alcohol addiction and help the entire healthcare ecosystem get the right data at the right time.
Okay, and I'm going to apologize to everybody now. We just cannot seem to get away from the construction, so that's what's happening. So we hope you can hear us.
So we're building new technology
We
to
are.
prevent relapse from drug and alcohol addiction as we speak.
As
right
we
here
speak.
in Dallas, Texas.
As we speak.
National
That's
Alliance.
what's getting built over there, just kidding.
Recovery never sleeps, Tracy.
There you go. So tell me a little bit about your story, and I'll come back to you as well.
My story, well, I grew up on a Christmas tree farm in northern Michigan. Became a professional tennis player
Okay.
and French Open champion in 1993. And on the outside, I had a life beyond your wildest dreams. But on the inside, I was dying because when I drank, alcohol had a different effect on me than my peers on the tour. I found myself isolating and depressed. And the jumping off point was with the birth of my son in 1999 at the U.S. Open. I was at a jumping off place, and instead of the hotel manager calling the police, he called an interventionist. And that interventionist taught me about addiction, recovery, and asked if I would be willing to get help. And I, for some reason, said yes. And as a result, I stand here today with you. And at that time, going to a detox and going into a hospital system, I thought it was the worst thing that could have happened to me. And it's turned out it was the greatest gift on the planet because I was free from substance abuse disorder and alcoholism, and I got my life back. I got a life, and today I get the chance to work with Daniela and serve our planet in a way that's way bigger than winning a tennis match. And it's sharing my recovery story, our business, and actually improving outcomes for treatment centers, patients, providers. The opportunity is a great one to serve our country right now.
Okay.
During in a time during the number one national healthcare crisis in the nation, it's dark times, and it's real personal. So I'm inspired daily. It's real easy to go to work when it's bittersweet. The sweet part is we get to see people's lives get restored and people thriving in recovery and communities thriving, and everyone in the healthcare system now has a tool as a result of Daniela's genius that supports someone's recovery once they leave treatment, and the key stakeholders stay connected. We address the two drivers of relapse. What are they, Daniela?
Lack of accountability and lack of connection to your community.
Lack of accountability and lack of connection to your community. And that's why people fall off the bandwagon?
Support community. Yeah.
Okay.
So basically not staying accountable to their treatment plan, which involves 12-step meetings or doctor appointments or meditation, whatever that looks like. And then not being connected when they're starting to fall off to their peers, family, or clinicians.
Okay. And you guys have developed a tool to help combat that. Yes. Talk a little bit about the tool. What is it, and how do people get it?
Yeah, and so the mobile app, the patient-facing mobile app that we've created, people can get in treatment centers, drug courts, or outpatient outfits, or MAC clinics. And it's a mobile app that helps them keep their schedule on track of all of those recovery activities. It also verifies by location and time that they actually attended those support activities. So then their support network can get visibility to know for sure that they're still on track and support them in that journey and get them back on track if they're falling off in terms of staying compliant with their treatment plan. Within that app also you can gain, as you achieve milestones, you can get rewards like Starbucks cards and fitness classes and all kinds of things that help you helps them be incentivized in staying compliant with their treatment plan, but also just makes you feel good and makes you happy and rewarded that you are having a huge behavior change.
And how do they get the app? Is it just available in the App Store?
It is available in the App Store, a light version, direct to consumer, or they can get the full-fledged version in inpatient, outpatient, MAC clinics, or drug courts.
And the second product, which Daniela described, is the data dashboard, the enterprise data dashboard, and who that serves.
Yeah, and so the other component of the whole product offering is the data dashboard, which is specifically for the treatment centers, specifically for the drug courts, to keep their entire population tracked. They can see progress in there, and also they can get reporting and analytics that helps them make better decisions for outcomes.
Okay, so this is not just for the common consumer. This is also in conjunction with an actual treatment program.
The hospital system.
Okay, and I believe you guys said that there are certain protocols, day 0 to 7, 7 to 14, 14 to 21. So you're helping them with these really programmed steps along the way.
Yes.
Make sure that they have a path to success.
Yeah, and day 28 to day 365. At day 365, the relapse rate goes from 85% at day 28 in your first year of recovery to it drops 60% for someone that reaches a year of clean and sober.
Let's go back to that. That's a big number, and I want to gloss over that. 85%
relapse rate
within 90 days?
the first year.
The first year of recovery.
And most of that, the bulk, is within
the first 90
days.
The first 90 days. Okay, so what are your analytics showing you that with and without this tool, what's the success rate?
Yeah, so we're seeing a huge impact on recidivism, particularly in the first 6 months, because we've been operating for just a couple of years. So for example, with the veteran population in the first 6 months, we saw 76% engagement in the app. So we actually flipped the statistic completely. But I would say on average, we're seeing 20 to 34% more more relapse prevention than the normal population without the tool as it stands right now. So we're releasing our new product. We've already made a huge impact in the relapse rate. And with our new product and some adjustments, I think it's going to continue to go up exponentially.
Wow.
Yeah, and the rewards keeps people engaged with their recovery activities.
Sure.
You know, they're getting positive notifications, positive feedback, and, you know, for lack of a better word, a pat on the back for each day they stay sober. It could be a Starbucks gift card. It could be a yoga class. It could be something healthy. All the things that you might want in your first year of recovery, but at the same time, it's like, affirmation, keeping my recovery front of mind, power of intention, the engagement rates are through the roof. It's almost flipped on it just through rewards and contingency management, and I think that's really our sweet spot.
Sure. You talked a little bit about a program with veterans and the phones. Can you tell our viewers about that?
Yeah, so we work with an organization called Volunteers of America, and they obtained a grant through SAMHSA. And so they engaged with us, and it's the veteran population in Southern California. And they've been like a huge joy to work with. They're incredible, just not even on the staff side, yes, but also the participants have been absolutely inspiring and amazing. And we partnered with T-Mobile to provide them with smartphones in the cases where they did not have a smartphone. So we're able to not just, provide the application to people that have smartphones, but we're also able to educate people without smartphones on obtaining it, providing that for them, educating them on how to use a smartphone outside of our application, to be able to use email and make it to their job interview, to make it to their meeting with their social workers, all of these things that are hyper important. So we're able to make an impact on their overall quality of life.
Okay. Talking about the overall quality of life, how does addiction and that struggle tie into the crisis that we're seeing in mental health right now?
I mean, it's directly correlated. When you're looking at homelessness, for example, the primary factor in that is typically some sort of co-occurring disorder, and they're all tied together. In substance use disorders, 76% of people that have substance use disorders have another co-occurring disorder. So the way that we built our application is actually not just program agnostic for substance use, but they can use our application for other co-occurring disorders. So staying on track with medication, going to their therapy session, anything that has to do with the broader set of compliance that they need to adhere to.
Okay. And I believe you said at the very beginning that this involves the family. It involves the social community, their support system. How, if I'm trying to support somebody who is suffering through this or is on their road to recovery, how do I do that through your app?
Yeah, so in our app, it'd be up to the individual to click invite, to invite you onto the application, and then you would have access to it for free. You can download it, and then you can see their progress in the app every single minute.
Okay.
You can also message encouraging pieces of, inspirational quotes or encouraging things as you see people achieve their milestones.
And this also helps, if I'm not mistaken, I understood you say that this gives you some warning. There are some precursors based on behaviors or lack thereof.
Yes.
Can you speak to that?
So when if you're my supporter and my recovery activities drop below a certain threshold, say 70%, you're going to receive a notification that it's been 3 days since Murphy's been to a support group meeting. It's been 2 days since he's missed 2 therapy sessions. Probably wouldn't even take that long, but you'll get a notification. All the key stakeholders of my recovery, when my recovery activities drop below that threshold, you get a notification that Murphy might need some extra support today. Most importantly, which is I'm fired up about, is the SOS feature. That risk score that we built in the data dashboard shoots me right to the top of the list for a therapist for you. That if I hit that SOS button, it's, reach out to Murphy now.
Wow.
He needs your help.
Wow.
Yeah.
So this is how we're using technology for good.
Yes.
Okay.
Yeah.
So how does this tie into insurance? I heard you talking a little bit about FDA approval and some of those programs.
Yeah, so, and just to piggyback off of what he said, so in addition to the SOS kind of flow and the alerts, we've developed, which ties into insurance, a patent pending relapse risk score algorithm that also analyzes the behavior on the app, as well as if we're plugged into the EHR, historical data for co-occurring disorders, and that determines your risk 1 to 100, what that risk is for relapse. So the way that we're looking to engage with payers, and we're working on engaging with payers and proposing, is that we can get coverage from the payer for all of their in-network providers, and then we can onboard all of those in-network providers. There can be coverage there. They can use a code basically that would unlock the subscriptions that's unique to that provider, and then we can feed back all of this outcomes data with reporting and analytics that they need to see for impact of their population back to the payer. But in addition to that, the payers are also looking at us in a different way as well, which is that we did do a pilot about a year ago with a telemedicine company, and we showed that we tripled the engagement between the therapist and the clients by using our app as the supporting technology for it.
Wow.
So the other way that we're approaching payers is like, hey, let us serve your current telemedicine vendors and be the supporting technology to manage all of that.
What an amazing tool to have one thing pull all these resources together. That's one less stressor that someone has to deal with when they're going through this process of trying to get better. Okay, tell me what your mission statement is. I was kind of blown away by this.
Saving lives through relapse prevention, number 1. Daniela, number 2.
And through providing accurate outcomes data to impact healthcare ecosystems and families thriving in recovery.
So you've taken the heart and married it with the analytics.
Exactly.
Love that.
Yes.
Okay. Where, again, do we find the app? Because I don't want anyone to miss that.
Totally. So if you go to WEconnect, one word, recovery in the App Store on Android or iOS, or you can also find us at WeConnectRecovery.com.
Okay. Thank you both for sharing your stories and telling us about your company.
Thank you so
Tracy.
much.